Our special guest today is Mr. Vijay Bhatt. He is Deputy Chief Technology Officer at Harvard Pilgrim Healthcare. Harvard Pilgrim Healthcare has really changed the healthcare industry in the area by providing a very interesting, diversified coverage to people from the various communities, businesses, as well as the mainstream. We are going to talk to Mr. Bhatt about all these new initiatives launched by Harvard Pilgrim Healthcare. Vijay, welcome to our studio.
Thank you, Upendra.
You are welcome.
Yep.
So let us start. Harvard Pilgrim has been a real pioneer in coming up with the diversity, the coverage of alternative medicine, inclusion of various different type of communities.
Correct.
So we want to start with Eastern Harmony concept.
Sure.
Tell us about what it is, when it is start, and what is its goals and objectives.
Okay. So Eastern Harmony is really a program, and in that program, we wanted to integrate Indian and Chinese medicine as well as well-being concepts into the insurance products that we provide, so that we become culturally competent with those communities. And we started that program about, I would say, 2 years ago. And we have started introducing alternative kind of approaches in that program as part of our product creation.
So what are some of the alternative medicine type of services insurance you provide for?
Sure. So alternative approaches such as acupuncture. These are all evidence-based practices that have received a lot of traction in the communities. So for example, acupuncture is one of them. We have Ayurvedic practices. We have yoga, meditation. We have practices such as naturopathy. We have practices such as homeopathy. Energy healing is another one. And we have things which are to do with, did I cover yoga and meditation and so forth. So those are the kind of practices.
So, this leads me to two questions. One is that what has been the response of the community and the people who have been using this type of services? And has the Eastern Harmony got traction you were looking for?
Okay, so that's really, as I said, we just started this program about 2 years ago. And these particular alternatives are not just meant for these communities. It is open to anybody.
Everybody,
who purchases,
of course, sure,
right?
Sure.
So one of the benefits, that's the acupuncture benefit, we actually integrated that as part of our product offering as a benefit starting last October. And it is now available to all our members. So they can go and have up to 25 visits as part of their plan.
So now, is it, for example, like say if I have Harvard Pilgrim Healthcare insurance, so do I need to take a separate insurance for the alternative medicine, or it is everything comes in one package?
Right, so I'm getting that. So as far as acupuncture is concerned, it comes as part of your product.
Okay.
Now we are starting to integrate or offer these other alternative practices through our partners, right? So we have partners such as Healthways, who have providers with whom we have relationships for offering discounts. Okay, so for example, if you go for Ayurvedic kind of practice and looking for some kind of an alternative there, we have relationship with Ayurvedic practitioners. Similarly, we have relationship with energy healers, and you can get discount. We are, however, planning to integrate that as part of our benefits over a longer period of time. The whole idea there is that we want to kind of understand the response of the community. If there is really a preference, then that is the direction we plan to go. Now, even if that makes you feel good, okay, experience in my books plays a higher importance to one's well-being than just injecting medicine, right? So if you feel that by doing acupuncture it's relieving your suffering, then there is nothing wrong in going ahead with that. Now, if you are doing panch karma and that does the cleansing of your system, detoxing your system and removing all the toxins, then that's a wonderful practice for everybody to follow. And that is what we are, over a long run, that is what we want to sponsor.
Now, as we have seen lately, that there has been tremendous evidence from great scientific and medical institutions in support of yoga, meditation, mindfulness, that it does work very effectively. But also there has been some other reports, for example, if you take in alternative medicine, homeopathy, for example, and there is some sort of skepticism. So what is your, is there policy of Harvard Pilgrim Healthcare to endorse those type of practices, or basically you provide just the insurance for that?
We just provide, we don't endorse practices from that perspective. Okay. I mean, they are specialists who understand what the benefits are, and they are scientists who are doing all the research and so on. But we basically provide, as I said, we work with the providers to provide you discounts for getting those kind of practices. However, if that makes you feel good, okay, and it relieves you from your suffering, there is nothing wrong in trying it, as long as it's not harmful to you. Okay.
So now let us talk also about your this unique concept of communities of wellness.
Okay.
So what is communities of wellness?
Yeah, communities of wellness is basically what we are trying to do here is to create a culturally competent environment for the Indian and Chinese communities, right? So we want to create or have a network of providers or physicians who can, who know culturally from a language and other perspectives how to communicate with one of our members, and they live very close from where the members are. So that is one of our kind of initiative.
And the cultures you are, of course, you know, the Indian, South Asians, Chinese. Is there any effort, initiative going on, or you have already for Hispanics or African Americans or other communities?
Yeah, we have, first of all, a lot of our content on our web pages are getting converted to Spanish as well as Chinese as part of this whole initiative of Eastern Harmony. So we are not just focusing, I'm just saying Eastern Harmony, but there is all other communities that we are working with.
Like, for example, anybody can come and they can subscribe or prescribe to the Eastern Harmony.
Oh yes, absolutely. Course, it's an open product, right? And anybody can. So as far as Latino, we have a Latino Action Force. It's what we call Employee Resource Group, which promotes leadership, diversity, as well as promotes community action events and so forth, as well as practices to the Latino community. And similarly, Chinese promote their cultural competence to the Chinese community, and Indians do the same with the Indian community and so forth.
Now, there is another aspect to what your group is doing, is cultural aspects, bringing cultural aspects into the health and wellness. Tell us a little bit about that.
Sure. As far as health and wellness is concerned, we internally we have quite a number of with this whole communities of wellness. I wanted to also state that we are sponsoring local groups like Saheli, for example. Saheli has done a very good job in terms of domestic violence prevention, and we sponsored them as our Count Us In partner in last year's event, and we plan to do that this year as well. So we are starting to sponsor those kind of groups. They are also the Asian American Civic organization
Sure.
that we are sponsoring. Similarly, internally to our organization, we have something called employee resource groups. And these are like Black Leaders Forum, there's Women's Development Group, there is LGBT, there is also My Members Wellness, and so forth. And the whole idea about these groups are to promote wellness practices, well-being practices. One thing that is near and dear to me is My Members Wellness, where I'm one of the executive sponsors, and the goal up there is to actually have our employees become what are known as community ambassadors within their communities to go and promote and advocate wellness practices. Okay, and wellness practices are something that are prevention based. For example, nutrition and diet is having the right kind of nutrition and diet is helpful, evidence based, helpful to you. Exercise is very helpful to you. Stress management, time in nature, community service, building relationships, self-actualization. We use the word swadhyay in Indian, which means self-development.
Sure.
Those are the kind of practices that we want our ambassadors to take to the community.
Sure.
So that is one really good program that we are
So
starting.
talking about ambassador, how big? Tell us a little bit about the size of the Harvard Pilgrim. How many people work there?
Well, Harvard Pilgrim Healthcare has about 2,000 employees, and out of that, 800 are Dell Services employees. Okay, we outsource our IT functions to Dell. The rest are Harvard Pilgrim employees, and we have. We are recently we have been the number one organization in the country as far as NCQA is concerned. And that's the quality assurance. And we have been doing that for 10 years running. So we have a practice where we have our foundation, which again does a lot of these activities to reach out to communities and work with communities.
And what are the states where you provide the services? Insurance.
Right, absolutely. So we are in Massachusetts,
Of course, yes.
obviously, New Hampshire, Maine, and recently we also entered into Connecticut.
Okay.
And we are expanding in Connecticut. So those are the states. Now, those are the New England regional states, but we also have, we also provide our plans to folks across the country through United. So we partner with United in a program
United Healthcare.
United Healthcare. In a program what we call Access America. So their members can come and access our network of providers, and our members can access their network of providers throughout the country.
And suppose if somebody comes through United Healthcare, this would be also able to use all these Eastern Harmony concepts and everything.
If they buy into the plan.
If they buy into the plan.
Right,
okay.
exactly.
Okay. Now, the fourth interesting aspect which you have started to do, Harvard Pilgrim, is providing insurance coverage to the visitors from overseas.
Correct.
And those of us, who are immigrants here and, our family and friends come, this becomes a big issue. This also involves a lot of, scam too, like, you buy this and you don't know what's really going to happen. So tell us, when did you launch this program and how it works?
Yeah, we launched this program last year.
Last year, okay.
And the goal is that our name is associated with a visitor insurance organization, right? So we have partnered with IMG to offer this travel insurance, travel health insurance. So visitors from either Chinese or Indian communities, as they visit USA, for between 5 days to 2 years, they can buy into this plan.
Okay.
And
so they can buy for 5 days, or they can also buy for 2 years,
up
or
to
1
2
year,
years, right.
depending on
exactly
whatever.
how long they stay.
Okay.
And the goal here is that some of the plans we have actually worked with IMG to make sure that they fit into our
So, for
standards.
example, like say somebody comes from, say, India, and they have some really very serious pre-existing conditions,
Right.
and they come here and they're fine, and suddenly they get into that. So,
Right.
how is that covered, or how you?
Okay, so that's a tricky one, right?
Okay.
Initially, we do, as far as the plan is
Mm-hmm.
concerned, we do not cover pre-existing conditions
Okay.
in the initial plan.
Okay.
But we are talking to another organization which has coverage for pre-existing condition
Okay.
of up to $50,000 or so on.
Okay.
Right? But what we do cover is any emergency that happens, as well as any other ailments that you may fall under while you are here.
Well, here.
Yeah.
Okay. First of all, I would like to thank personally Harvard Pilgrim Healthcare. They have been a big supporter of our newspaper, Indian News. They have supported our All Health Expos and our flagship event every year we do Women of the Year.
Sure.
I just wanted to thank you for all your help and support.
Sure. Thank you, Pendra.
Thank you.